We'll be looking at pharmacoepidemiology, and if even if you don't understand what pharmacoepidemiology is, if you look at the word epidemiology, you should actually like guess what pharmacoepidemiology is. Epidemiology, every time we talk about a disease condition like typhoid, schistosomiasis, we always talk about the epidemiology of those disease conditions. And we talk about basically the effect of that disease on the whole world, right? Would also talk about the regions in the world where this disease is on the high rise and all those stuff, right? So pharmacoepidemiology is basically trying to um, look at the effect of a drug when it is now released to the general public. Okay, the effect on the drug on different sets of individuals, right? Because the enzymes needed for this drug action, you might have them in sufficient amount, I might not have them in sufficient amount. Okay, so that's what pharmacoepidemiology is. So pharmacoepidemiology is a subfield of pharmacology studies. Okay, and it studies the effect of drugs when used in the general population or in specific groups. Okay, now the signal or data on the uses or risks of the new or old drug can be generated from what? Pharmacoepidemiological studies, which can be classified as what? Experimental. There could be clinical trials to actually, right? There could be clinical trials to actually check out for the safety of the drug and efficacy of the drug. You understand? And observational, that's where you talk about the case report, the case control studies, the cohort studies, and the quasi-experimental study design. All right, so for the observational, this is you basically, okay, the drug is now in circulation. So as the drug is in circulation now, you're trying to actually look out for adverse effect. Let me shed more light on this. When you were making this drug, quite all right. You did the experiment on 100 people, 200 people, 600 people. That was nice. Okay. But 200 people and 600 people are not the total number of people in the world. Okay. So, in as much as this drug was termed safe on those 200 people, 600 people, when you put it out in the general population, it can have adverse effect. Let me say, for example, you are making a drug and you used Brazilians to actually test run this drug. When you send this drug to Nigeria, there could be a way that Nigerians are now reacting to this drug differently. It's because of the genetic makeups, right? So that's why we also study pharmacogenetics. Okay, so epidemiology, you are trying to look at the drug effectiveness by the conditions, comorbidities, or populations. You are trying to look at the pattern of the use of the drug too. That's off-label use by conditions or population. You are trying to look at decision making. That's clinical and health policies, right? If this drug should continue to be used or withdrawn from the market. You are looking at the pharmacoeconomy. That's basically the cost effectiveness of that drug, cost benefit, and cost utility. All right, then the pharmacovigilance itself, you are looking at the unknown, rare, serious, and long-term adverse drug reactions. Then you are also looking at the drug-drug interactions, okay? This drug that is now in circulation, if this drug is now given with another drug, what will be the effects and all those stuff, right? So guys, that's pharmacoepidemiology. This is the introductory lecture to it, right? So subsequently, we'll be making more videos on pharmacoepidemiology with well-known examples, right? So see you guys in the next tutorial and bye for now.